Can a single counseling session make a lasting impact on patients? So, growing up as a bit of a skeptical person, my first instinct would be to say no, right? Like real change, it must take longer than that. But I want to tell you a quick story. So, I'm a writer and I got hit really hard with writer's block during my last couple years of undergrad. And I could not seem to get out of it. And you know the drill. Everything that I did wasn't good enough to turn in, much less publish. And so I didn't write it down at all. And I would always just sit there and stare at the blank page. And I read a bunch of books trying to figure out how to tackle this and some web articles, and nothing really seemed to work. And, you know, the more I saw everyone else writing, the slower I wrote, and it was out of control. And then one day I was reading, let's see, it's called Signature's Ultimate Writing Guides. And it's this little free publication. And I came across an article in it. This is like a one-page article, mind you. It's very short. And it said, you'll get over writer's block when you start to perceive your first draft as beautiful. So your first draft, it might not be something that you want to share with other people, but it's still special to you, even if it's messy and incomplete. And it still reflects a part of who you are and how you're thinking in each specific moment of the writing process. And that's something you'll never get back if you don't write it down in that moment. And just like that, I was cured. I was at least on the right path again, and I had to keep working at it. But suddenly I had this little tool that I needed to get where I wanted to go. It was this carefully worded little message that appealed to my psychology. It was my pat rat mentality, I think. So I just started saving a lot of draft files, the V1, V2, V3, V20, it didn't matter. And always saving these, quote, special little moments. And I never really struggled since then. So my point to that is a single executed moment which appealed to my personality. It really changed my life and it helped me grow as a writer. It helped me push aside mental barriers. And so knowing that this happened once, I'm wondering if meaningful change like this could be reliably generated by an objective third-party observer, such as a psychologist. So for this episode, let's talk about ways that single-session intervention models can make a lasting difference in people's lives. Hello there, this is Bradley, and you're listening to Psych Everywhere, a podcast by PsyChi, the International Honor Society in Psychology. For this show, distinguished guests weigh in on applying psychological science to a diverse range of current events and to better your life. Would you prefer to read along as you listen? A written transcript is available. See the link in the show notes for this episode. Today's guest speaker is Dr. Jessica Schleider, who is an assistant professor at Stony Brook University and served as a faculty affiliate at the Alan Alda Center for Communicating Science. She earned her PhD in clinical psychology at Harvard in 2018. Dr. Schleider has secured $6 million in federal funding, foundation, and industry grant funding. She's won numerous awards, such as the National Institute of Health Directors Early Independence Award, and her work has been featured in the Wall Street Journal, the Washington Post, the Atlantic, and now Psych Everywhere, and others. Dr. Schleider, welcome to Psych Everywhere.
Thank you so much. I'm delighted to be here.
Oh, I'm so excited to talk about this topic. It just kind of hit close to home for me when I saw it. And so I really wanted to see what you had to say. So my first question is, what are some reasons why a single session model is useful instead of the traditional week by week?
Absolutely. It's a great question and probably the first question that most people ask about this topic. There are lots of reasons, both logistical and personal, why a single session model might be useful. First of all, the reality of mental health care in the United States and across most of the world right now is that a majority of people who need mental health support aren't able to get it. Up to 80% of young people and up to 50% of adults who need mental health services cannot access any. And that's because of provider shortages. It's because of costliness of psychotherapy. It's because of long waiting lists. And it's because of things like stigma and personal barriers to accessing care. All of these things combined mean that traditional once weekly gold standard psychotherapies, even if they do work for the people who access them, aren't going to meet public health level needs for mental health support. So there have been many calls to diversify the kinds of supports that are available to people, including briefer and more scalable interventions. And I'm particularly excited about the promise of single session interventions to fill some of these gaps because in reality, the most common number of times somebody accesses care, if they do, is once. And that's consistent across the US, Canada, Spain, Australia, a host of countries around the globe. So if we can figure out how to make the most of the first and often last session that people access, then I think we can fill a lot of the gaps that our current mental health care ecosystem just isn't designed to fill and never was. So single session interventions, from my view, can be a wonderful complement and a way of extending more traditional models of treatment.
I imagine that there are a lot of different kinds of single sessions, face-to-face or even computer guided.
Yeah.
So I saw that you worked on a meta-analysis looking over 50 studies, and I'm going to put a link to that in the show notes, by the way. So I'm sure you've seen all kinds of SSIs. Could you share about some of the different methods that have been used?
Absolutely. So you were right on the money in suggesting that some of them are delivered by a professional psychotherapist. Some of them are self-guided digital interventions. That's becoming increasingly what my lab is studying, given the inherent scalability of digital programs like these. But really, single session interventions aren't linked to a specific theoretical model of therapy or an approach. Instead, they're a way of conceptualizing how change can occur, intentionally designing that one session to potentially be the last one, to make each session stand alone. That's the common thread across all the different modalities of single session interventions. They're designed to instill the belief that change is possible in any moment, however brief. And they acknowledge the dual reality that people may benefit from additional support and may not be able to access it. So single session interventions can be directed towards parents of young children, teaching parenting strategies and types of praise that support positive behavior change. They can be single session self-guided programs, not dissimilar from the article that you described reading that served as a single session moment for you, that create new ways of looking at the world or at the self that can spur positive next steps in behavior change. But really, the common thread across all the different ways of approaching a single session is that intentionality piece, that goal of making this session count, even if it's the last one somebody gets.
In what ways have single session interventions changed over the years? And do you think they're becoming more common?
I certainly hope they're becoming more common. That's part of the goal of the work that my lab does, is to help more people implement them in ways that would benefit their systems of care, and benefit those who never access systems of care. So the history of single session interventions is longer than I think a lot of people realize, especially in the field of psychology. The first work on single session interventions was happening in the 1980s and early 1990s, both with researchers who were studying exposure therapy for specific phobias that lasted just one session and could function just as well as multi-session therapy for treating specific phobias, and for more person-centered single-session counseling services. That work was mostly going on in Australia and the United Kingdom. And initially, these interventions were delivered only by highly trained professionals in clinical settings, face-to-face. And as technology has advanced and as more research has emerged in fields like global mental health, suggesting that folks with less formal psychotherapy training can successfully deliver certain low-intensity interventions, the scope of practice with single session approaches has really expanded to include digital, self-guided activities, as well as interventions delivered by folks who don't necessarily have a PhD or a master's degree, but who can still be successfully trained to deliver a single session that's structured, that can be helpful. So I think over time, they've veered more towards models that are accessibly disseminable, which is a good thing overall for public health. In terms of whether they're becoming more popular, I'm probably the most biased person you could possibly ask that question to, because in my world, they're certainly becoming more popular. That's pretty much all my lab studies and tries to disseminate. And I do feel optimistic given the number of clinics and healthcare systems and school settings and emergency departments that my lab has partnered with and supported in delivering these types of approaches, that they are becoming a little more mainstream. But there are a lot of steps, including models of insurance reimbursement, that will be necessary to tackle before SSIs, as I prefer to call them because it's shorter, are really disseminated broadly and available to people at scale.
If someone knows that they're only going to be able to attend a single session, what should they do next? Are there specific counselor qualifications that they should look for, or should they at least inform the counselor ahead of time that this probably is going to just be a one-time thing?
So the reality is most counselors and professional therapists aren't trained in single session approaches. Mm-hmm. They aren't going to automatically provide them. But there are ways of incorporating single session models to complement longer term services. So that way it becomes a situation where people can come once for a certain kind of service that's intentionally single session, or they can choose a longer term service if that works for their lives and their needs. So at our clinic at Stony Brook University, we actually offer single session consultation programs to everybody on our waiting list for longer term psychotherapy. The single session consultation is a program I developed that is based on something called solution-focused brief therapy, and really just helps that individual get one step closer to a hope they have for their future life. Very simple, but they leave with an action plan and concrete steps towards making a change that matters. The smallest possible change that they will be able to detect. It's designed to boost hope and a sense of perceived agency and the sense that they can do something where before they might have thought they couldn't. And this is a service that we offer to people right when they seek care. So right when they call into our clinic, we say, so our wait list is a few months long, but if you would like, we offer this single session consultation where you can come in, meet with a provider, and leave with something tangible that you can do while you're waiting. So by intentionally framing the session as a single session service, the expectations are set both with the provider and with the individual that this is why we're here, this is the goal of today. Single session interventions that happen accidentally or that somebody isn't expecting beforehand tend not to go super well because somebody is under the impression that the therapy is going to be something that it's not. So beforehand agreement on why we're here and how long we're going to be working together is really important for the single session model to really be helpful. But currently, the majority of providers don't even have this in their sort of repertoire of things they can offer people. So it's not typical that somebody will be offered a single session in the real world today.
You've already answered or mentioned a couple of examples, but I wondered if there were any others of particular patient issues or situations that might be more or less effective with a single session. And maybe you could mention you did a study in 2017 regarding youth-reported anxiety versus parent-reported.
Sure. So in terms of the types of problems that single session interventions are most helpful for, we've collected data and tested out different single session interventions on thousands of young people and parents at this point, and even our fanciest machine learning models haven't been able to tell us very much about who benefits most from these interventions. Things that we thought would predict response, like how severe are your symptoms? Do you have suicidal thoughts or behaviors or self-injurious thoughts or behaviors? Are you in a more highly stigmatizing environment that may prevent change from happening? These are all things we've looked at as possible predictors of response to single session therapy. And they haven't significantly predicted results or outcomes of these interventions in any consistent way, which is both confusing and promising. Because on the one hand, that means that they can potentially be helpful for a really wide variety of people with different identities, different problem types, and at different levels of severity with the things they're struggling with. But on the other hand, it doesn't really help us with targeting the single session interventions to those they might benefit most. Some people who study single session interventions suggest that people who have a good sense of their goals might benefit most from a single session, which I think is certainly true with respect to the in-person sessions that are more goal-directed and problem-solving oriented. But other single session interventions that we've developed, the goal is just to increase someone's sense of hope for the future a little bit, or to increase someone's sense of control over their thoughts, feelings, and behaviors a little bit. And that can spur upward spirals of subsequent change. So no matter where you're at in terms of the difficulties you're experiencing or what those difficulties are, my sense and my working assumption is that the change is always possible no matter what your starting point is. And even a small change can be important in the path towards more sustainable change. So in my view, there's a potential for any single session to help somebody regardless of what they're coming into the room with. However, what the outcome is and what you're expecting that single session to do might differ for different people.
How can a counselor know if their SSIs are leading to real growth? Because they don't, a lot of the time, I imagine they never see these people again. So,
absolutely. We've done a little bit of work looking into how do we know who's going to respond to single session interventions. And one way we've been able to predict future response is by looking at and measuring levels of hopelessness and perceived control right before a single session and right after a single session. And in randomized trials of adolescents with depression and anxiety, for example, we've found that those immediate shifts in mechanisms of change of these single session interventions, like changes in a sense of hope for the future, changes in a sense of perceived control, the larger those immediate shifts, the more likely somebody is to respond later on in terms of sustained reductions in depression and anxiety. So there are markers that you can use looking at immediate shifts in attitudes, behaviors, and hope for the future that can at least forecast whether somebody is likely to benefit. The single session model is also inherently person-centered and focused on empowerment, such that you trust the patient to know whether they need more, right? So a single session model at its core isn't a one and done model. It's a one at a time model, in that anytime the patient perceives a need for support, they should theoretically be able to access a single session intervention that can help them get through that moment and make a small but meaningful shift. So if we're trusting the patient to know whether they need more, and we make single session approaches broadly accessible, then theoretically, at least, they can seek out care precisely at points of need and in the doses that are going to matter most to them. So I think there are a lot of factors relevant to your question that are worth considering. But again, this is all hypothetical right now, as these things really aren't broadly implemented yet at a public health scale.
I think you kind of already answered this next one to a degree, so you can skip it if you'd like. But the question is, what things should a psychologist do to increase the effectiveness of a single session?
There are a few things that a provider can do to make a single session as impactful as possible. One is setting really clear expectations with your client or patient at the beginning. You can say something along the lines of, this meeting isn't going to be a regular therapy session. This is a single session support. And what that means is that I am not, assuming that we're going to be able to meet again, That will depend on a whole host of factors. So assuming that today could be our only meeting, I am super committed to making this next hour as important as possible for making real steps towards a change that matters to you and that's going to make the biggest possible difference in your life. And we're going to work together to figure out what that change can be. But the reality is we have a whole hour to work together to figure out how to make that happen for you. So we're going to be super goal-oriented and focused for this hour with the real goal of making a small but meaningful change in your life. So setting the expectation up front that not only is today going to be a single session intervention, but that change actually can happen in a single session. Provider expectations for whether change is possible and how that change is possible have a huge impact on patients' expectations and engagement. So both providers' attitudes and expectation setting are really, really important. If you, the provider, don't believe that a single session can help, your patient will notice that, and they will be less motivated and engaged. Another thing that providers can do to make single sessions matter as much as possible is offering them at the moment of outreach. Patients often contact clinics or providers and are facing long waits to the time when they can actually access care. That's a big problem because it takes a lot to reach out for help. Often people are spending a lot of time deciding whether their problems are severe enough to warrant help or whether they really need therapy. So they've already often got on a long journey before reaching out for care. At that moment of outreach, they are motivated, they are ready, and they recognize a need that they have. Unfortunately, that readiness, motivation, and perceived need are not really capitalized on if they're then told, okay, now wait for 3 to 6 months and we'll get back to you. So offering a single session consultation or intervention at that outreach point can take advantage of so many factors like motivation and perceived need that are important to outcomes. So I think the timing of single session interventions, providers' attitudes towards belief that they can help, which is in line with the evidence, and expectation setting are 3 really important pieces.
So I told sort of my origin story for being interested in this topic, and I wanted to give you that same opportunity. So how did you become interested in SSIs?
So I loved your origin story because I think so many people resonate with the sort of inflection point experience of something small happened in their own life that made an outsized difference on their own beliefs and behaviors. That's a really common experience for people in therapy and outside of therapy in terms of mental health outcomes. For me, it came from a place of frustration with how things were being offered and the shortcomings of existing mental health care systems. So I started my PhD program in clinical psychology thinking I would study traditional longer-term interventions, but in community settings, places like schools or community clinics and non-traditional places that could potentially help fill gaps in treatment systems, essentially bringing treatment to where people already are. That was a promising idea. And the more I started working in those domains, the more I saw that the implementation problems were so enormous that even these interventions that were designed to be more accessible and easy to disseminate really weren't successfully reaching the people who needed them. Kids still wouldn't be able to attend full programs if they happened multiple times over the course of a school year. People still, when I saw people in community clinics, when I saw patients, would be unable to come back after that first assessment session, at which they would really get no treatment. They would just be asked many questions. So I started to wonder whether there was something that we as a field could be doing differently that could optimize individual interactions with people to ensure that regardless of how their life goes, whether or not they can consistently access care, which is a rarity, we can help them. We can use our knowledge of psychology and behavior change and symptoms and recovery processes to make a small but meaningful dent. So I talked to my graduate school advisor about this, and I decided to do this meta-analysis that you mentioned earlier on, well, what do we know about what can be done in one session? As it turned out, I was by far not the first person to ask that question. There were already 50 randomized controlled trials, this was back in 2017, on single session interventions for youth mental health problems. And we saw that these interventions were effective compared to control groups, and that they sometimes perform similarly to longer term interventions. And when I realized that there was something that we could actually do systematically within a one session program, I was really motivated to figure out what that thing is. And that's what I've been working on since then. And I founded the Lab for Scalable Mental Health primarily to unpack that question of what can we do in individual sessions, assuming that many people will only be able to access support once, and how can we optimize the effectiveness of that one session and get those sessions to the people who are likely to benefit.
Do you have any comments for psychologists who might be thinking that if they just did single session interventions, that it could sort of put them out of a job?
Well, isn't that the goal? That's
I love that.
True and not true. The goal is for people not to require therapy anymore once they start. But more seriously, there will always be unmet mental health needs. The unmet needs right now are so extreme and severe and pervasive that our system is just failing large portions of the population. Many people are getting no evidence-based support whatsoever. A lot of people can't even get their foot in the door with treatment. So offering single session interventions is not going to erase or really even reduce the demand or the need for longer term forms of therapy, but it is going to provide a lifeboat for a lot of people who would otherwise access nothing and who are currently falling through the cracks of health systems that do exist. So I think it's a both and, not an either or, with single session interventions and existing forms of therapy that people are already providing.
What are your thoughts on group therapy sessions that are being used to help greater numbers of people? And can you think of any other ways to sort of increase the amount of mental health support that people get despite limited numbers of psychologists?
Yeah, so groups are a very popular way to increase the number of people who can take part in a session. Groups usually depend on a provider being present. So even that is still a major limitation in how broadly groups can extend. My lab has been largely focusing on models of support that can be scaled broadly because they don't require therapists to deliver them. So self-guided online activities, either on open access websites or even embedded into social media platforms. We ran a study with a wonderful nonprofit called Coco, where we worked with them to embed some of our digital single session interventions into their platform. Coco works with social media companies to embed digital mental health supports directly into the platforms that people use every day, so that when people search for things like therapy or suicide or help, they get directed towards resources that they can use if they want to. And we ran a study to see if our single sessions were perceived as helpful and useful to people who were users of Tumblr, a social media platform. And we found that they were. Over 6,100 people over the course of a year opted into using our single session interventions when they were directed to or suggested within the platform. And they were just as effective in Tumblr as they were in our randomized controlled trials. So I think there are a lot of ways, being a little bit creative and thinking outside the box in terms of where can support exist, that can open pathways to making mental health resources more broadly accessible.
Well, this has been a great conversation. I feel like I've learned a lot about this, and you've made me a lot more comfortable with the topic. I wasn't sure, like with my intro, was I taking the science out of it, by just telling a little story like that? And so I couldn't decide, like, am I on the right side of this, or do I need to go
You're
a different
totally on the right track. I wrote a book about single session interventions. It's coming out in a few months, and a whole chapter is dedicated to these turning points.
Oh, okay.
people experience, either in therapy or out of therapy, of like little moments that they can remember really mattering in a big way for their outcomes. So you're totally on point.
Awesome. Okay. Well, thank you so much for talking to me today. It's been a good one.
Pleasure.
You've just listened to another episode of Psych Everywhere. I hope you enjoyed today's conversation. If you haven't already subscribed to Psych Everywhere, go ahead and follow us wherever you go for podcasts. Tell a friend or a colleague about the show. Word of mouth is a huge help for podcasts. So share what you learned at the dinner table or in your classes. You can also follow us on Twitter at PsychI Podcast and leave a review at Apple Podcasts or wherever you go for podcasts. You'll absolutely make my day, and more importantly, you'll be helping us to get Psych everywhere. Okay, that's all for now. I'll connect with you again soon. Copyright 2023, PsychI, the International Honor Society in Psychology. All rights reserved.